Hey everyone, welcome back. Today we're diving deep into something I'm sure you've seen in the news, the Manipur conflict.
Sure.
But we're going beyond the headlines to uncover the often hidden humanitarian crisis
Okay.
and the data gaps that make it even harder to address.
Right.
It's a zone of the unknown, wouldn't you say?
Absolutely.
Hmm.
We see the figures 58,000 people displaced, living in relief camps. Pretty dire picture.
Yeah.
But the problem is those official numbers, they're only part of the story. It's like looking at a map with huge blank spots.
So it's not just about the number itself, right? It's about who's not being counted.
Exactly. For example, those who fled to other states, at least 12,000 sought refuge in Mizoram alone.
Wow.
And they're not in Manipur's official figures, so you can see the potential for underreporting is huge.
Yeah, that really makes you wonder about the true scale of this whole thing. But why IIS data collection so difficult in this case?
Well, there are a few factors. Physical segregation of communities is a big one. Makes it hard to get a complete picture. Meitei and Kukizumi populations are largely separated.
Right.
So those shared information channels that would normally exist, they've broken down.
So it's not just about physical barriers,
Hmm.
but the breakdown of communication, of trust
Hmm?
that comes with conflict. It's like trying to solve a puzzle, but you're missing pieces.
Exactly.
And it's not just those who fled to other states that we're missing in this data, right?
No.
The sources also mentioned young people leaving for education or work and people leaving to seek healthcare elsewhere.
Right, and that raises some crucial questions about the long-term impact.
Yeah.
We talk about brain drain in economics,
Uh-huh.
but here it's driven by conflict. This
Yeah.
exodus of young people seeking opportunity or safety elsewhere could have ripple effects on Manipur's recovery for years to come.
And those forced to seek medical care outside Manipur.
Yeah.
The source points out that this could lead to worsening health outcomes that might not be immediately apparent. Just adds another layer to this unfolding crisis.
It does.
It's almost like trying to fight a fire in the dark.
Right.
You don't know the full extent of the damage until much later.
Exactly. And without a clear picture, relief efforts become far less effective.
Right.
If you don't know how many people need help, what their needs are, even where they are, how can you target resources effectively?
It's a recipe for aid, not reaching those who need it most.
Yeah.
And it's not just about missing people either.
Right.
The sources also highlighted the underreporting of really crucial information like deaths, malnutrition, and even disease outbreaks within these camps.
Exactly. Imagine trying to track a potential cholera outbreak in a camp where you don't even know the population size.
Right.
It's a nightmare for public health officials. Really highlights the very real dangers these data gaps pose.
And when reliable data is scarce, well, that's when misinformation thrives.
Yeah.
Becomes incredibly hard to separate fact from fiction.
Yeah,
Could hinder relief efforts and even influence policy decisions.
absolutely.
And speaking of policy, the impact on healthcare in Manipur is especially concerning, particularly for the Kukizomi communities.
Yeah, before the conflict, accessing healthcare services in Imphal was relatively straightforward. But now, those in Kukizumi-dominated hill districts,
Yeah.
they face long and often dangerous journeys, sometimes having to travel through other states like Mizoram and Nagaland just to reach essential care.
And the sources shared some really heartbreaking examples. A 63-year-old man who died because he couldn't access dialysis, and a woman who died from postpartum hemorrhage in a relief camp.
Yeah,
It's just a stark reminder that this conflict is costing lives in ways that go beyond the immediate violence.
absolutely. These cases really underscore how severe the situation is. They highlight the urgent need to address the healthcare crisis in Manipur.
And it's not just physical wounds either. I know this is heavy stuff, but the sources also discuss the mental health crisis that's unfolding. The trauma of violence, displacement, and constant uncertainty, it's taking a huge toll.
For sure, and we have the numbers to back that up. One study found that 65.8% of displaced individuals in Imphal East are suffering from PTSD. And, well, Manipur, like many conflict zones, lacks robust mental health infrastructure. It's a recipe for a silent crisis to unfold right alongside the more visible ones.
It's a sobering reminder that the scars of this conflict run much deeper than what's immediately apparent.
And, speaking of lasting impacts, let's shift gears to the conditions within those relief camps that were established, over 2 years ago.
Yeah.
The sources paint a pretty bleak picture, highlighting issues with food, water, shelter, and education for kids.
It's unfortunate, but despite being operational for so long, these camps still struggle to provide even basic necessities. Imagine trying to raise a child, trying to give them some sense of normalcy, in an environment where clean water and food are scarce, proper shelters inadequate, and their education is disrupted.
It really emphasizes that this isn't a temporary situation.
Yeah.
The impact of this displacement is long-lasting, affecting everything from education to economic prospects for entire families.
And the economic instability caused by the conflict, coupled with rising inflation.
Yeah. It just exacerbates the situation. Families are struggling to afford basic necessities, making it even harder to break free from this cycle of hardship.
So we're seeing a convergence of factors here. Displacement, lack of resources, economic hardship is creating a truly dire situation within these camps. But the question that keeps coming to mind for me is, what can be done?
Well, while the situation is undoubtedly challenging, there are concrete steps that can be taken to alleviate suffering. And thankfully, those steps are outlined within the source material.
Okay, let's dive into those potential solutions. Let's discuss what concrete actions can make a real difference here.
One crucial step is increasing external support. Private organizations, corporations, individuals, they can all play a vital role in providing aid and resources to those in need.
It's about recognizing the shared humanity that binds us all and taking collective responsibility to alleviate suffering. It's about stepping up and filling the gaps where government efforts may be falling short.
Absolutely. Another critical area is improving access to clean water. The source highlights how a significant portion of household income in these communities is being spent on purchasing water from private sources.
It's almost unthinkable. A basic necessity like water becoming a luxury people can barely afford.
Government agencies and aid organizations need to prioritize clean water distribution to ensure that this fundamental need is met for everyone. And that's just one area where targeted action can make a real difference.
As we were discussing potential solutions before, specifically the need for more external support and better access to clean water.
Yeah.
Now, the source also brings up establishing humanitarian corridors.
Right.
Why are these so important?
Well, they're essential for ensuring safe passage for essential goods and services. Think medical evacuations for those in dire need, especially in those remote areas that have been cut off by the conflict.
Earlier, we talked about those tragic cases, the dialysis patient, the mother who died from complications. Those are just two examples that really underscore how urgent this issue is.
Absolutely.
These corridors can literally be the difference between life and death.
It's true. And it's not just about evacuating people.
Right.
It's also about making sure that healthcare workers and medical supplies can reach those in need.
Yeah.
Humanitarian corridors can really help bolster the capacity of those local clinics and hospitals that are struggling to cope with the influx of patients.
So it's about creating lifelines, both for those needing care and those providing it.
Exactly.
And we can't forget about the economic aspect either.
Of course not.
The source also emphasizes restoring those supply chains that have been disrupted by the conflict.
Right. The flow of essential goods, food, medical supplies between the valley and the hill districts.
Yeah.
It's been severely impacted.
What kind of consequences does that lead to?
Well, it leads to shortages, price hikes, and just increased hardship for everyone.
It's like a domino effect, isn't it?
It is.
Conflict disrupts these supply chains, leads to economic instability, which then further worsens the suffering within these already incredibly vulnerable communities.
Precisely. And working with neutral communities to restore these supply chains is absolutely vital to ensuring that there's equitable distribution of resources.
Right.
And to alleviate that economic burden on those who are already just struggling to survive.
So we're talking about a pretty multifaceted approach here, right?
We are.
External aid,
Yep.
clean water,
Uh-huh.
humanitarian corridors,
Yes.
and restoring supply chains.
It's all connected.
Each step is critical to addressing this complex humanitarian crisis that's unfolding in Manipur.
Yeah.
But, I keep thinking back to something you mentioned earlier about the lack of research and data on the India-Myanmar borderlands.
Yeah.
This region has a long history of conflict,
It does.
and yet it seems like we're still navigating in the dark.
That's a really crucial point. The lack of in-depth research definitely contributes to the data gaps we've been discussing. And it limits our ability to really understand the nuances of this conflict. It's like trying to solve a puzzle without all the pieces, or even knowing what the picture is supposed to look like.
And without that knowledge, how can we craft effective policies? How can we address the root causes of this suffering?
Well, we need more research, more analysis, a deeper understanding of the historical, political, social, and economic factors that are contributing to this ongoing conflict.
And for our listeners who are UPSC aspirants, this is where it gets really interesting. This deep dive isn't just about understanding the humanitarian crisis in Manipur.
No.
It's about understanding the complexities of conflict, of displacement, and the challenges of governance in a region as sensitive as the India-Myanmar borderlands.
Think of it as a case study,
Yeah.
an opportunity to apply the knowledge you're gaining for the UPSC exams to a real-world situation.
The data gaps we've discussed,
Yes.
the challenges of providing aid,
Right.
the need for sustainable solutions, these are all issues that policymakers grapple with on a daily basis.
Absolutely. And by engaging with these issues, by really delving deeper into the complexities of this conflict, you're not just preparing for an exam.
Right.
You're preparing to be informed and effective policymakers.
Exactly. And as you analyze this information, as you consider the challenges and potential solutions, we encourage you to share your insights in the comments section below.
Yeah, let's use this platform to foster a deeper understanding of this crisis, to explore the complexities of the India-Myanmar border region, and to think critically about what it takes to build a more peaceful and just future.
Now, as we move towards the final part of our deep dive, remember that while the situation in Manipur is challenging, it's not hopeless.
Right. The recommendations we've discussed, while just a starting point, they offer concrete steps that can be taken to alleviate suffering, support those in need, and work towards a more sustainable peace.
It's about moving beyond awareness to action. And that action can take many forms.
It can.
From supporting reputable organizations working on the ground to raising awareness within your networks.
Right. And for UPSC aspirants, it's about understanding the nuances of this conflict, engaging in those informed discussions, and developing policies that really prioritize human dignity and well-being. Even seemingly small actions can contribute to positive change.
And with that, we'll move into the final part of our exploration of the Manipur conflict. Stay tuned. We're back for the final part of our deep dive into the Manipur conflict. We've covered a lot, from those data gaps to the urgent need for aid and solutions.
Yeah.
But before we wrap up, the source points out one more area I found really interesting. Private organizations and corporate social responsibility. What role can they play in this?
That's an important point. We often focus on government aid, but there's a lot of untapped potential for private entities to really step up. Think companies with strong logistics networks. They could help with aid distribution, medical professionals could offer expertise, and corporations could use their resources for targeted relief.
So it's about recognizing that this isn't just a government responsibility. It's a challenge for all of us. We need a multi-sectoral approach. Harnessing the private sector's resources could really amplify our efforts to alleviate suffering.
For sure. And it's not just about charity, it's about recognizing how interconnected our society is. Conflict and displacement, if we don't address them, they can have far-reaching consequences that go way beyond immediate geographical boundaries. It's in everyone's best interest to be part of the solution.
Absolutely. Now, the source really emphasizes the need for emergency medical evacuation corridors.
Yeah.
Particularly for those in remote areas with limited health care. We talked about the tragic consequences of delayed care, those deaths.
Right.
Really heartbreaking.
These corridors aren't just logistics, they're lifelines. They make sure people who need critical care can get to hospitals quickly and safely. And they allow medical staff and supplies to get to those who need them. It's a two-way street.
So we're talking about a multi-pronged approach to this healthcare crisis, right? Evacuation for the most critical cases. Support for existing facilities, ensuring safe passage for personnel and supplies. A lot of moving parts.
It's complex, for sure. Requires a coordinated and strategic response. And we have to remember that things are constantly changing in Manipur. New challenges will pop up and existing needs will shift. Any effective response has to adapt.
It's a reminder that there's no one-size-fits-all solution here. What works today might not work tomorrow. We need to be proactive, constantly looking at how effective our efforts are and making sure we're adapting our strategies to the changing needs of those affected by the conflict.
And that brings us right back to the data gaps. Having accurate and reliable information is fundamental to an effective response. Without it, we're basically in the dark. We can't grasp the full scale of this crisis or allocate resources properly or even measure the impact of our actions.
It's about making sure that the people in Manipur are not forgotten, that their suffering and needs are not ignored. Their voices need to be heard. Their stories should guide our actions. Their lives should be at the forefront of our efforts to create a better future for the region.
And for those listening, especially those preparing for the UPSC exams, this deep dive has been a chance to connect the dots, to see how theoretical knowledge applies to these real-world challenges.
Absolutely.
Understanding the complexities of this conflict, the humanitarian crisis, and the solutions needed, it's crucial for effective policymaking.
It's not just about passing an exam. It's about equipping yourselves with the knowledge and skills to address complex challenges and make a real difference.
If this deep dive has sparked your interest, if you want to learn more, leave a comment below. Let's use this platform to understand the crisis better and work towards a more peaceful future for Manipur.
And don't forget to like, subscribe, and share this episode. The more we amplify these stories, the better our chances of creating meaningful and lasting change. All the information for today's deep dive came from The Hindu. Until next time, stay curious, stay informed, and stay engaged.